In June 2020, professional golfer Nick Watney was playing the RBC Heritage Tournament in Hilton Head, South Carolina. The morning after the first day of play, he did what he always does when he first wakes up. He checked his phone to see how well he had slept the night before. He was wearing a Whoop, a fitness and sleep tracker that provides real-time information on fundamental physiological parameters, including respiratory rate, heart rate variability, and total amount of REM sleep and slow wave sleep. He noticed his numbers were off. His respiratory rate had jumped significantly from the previous readings. He otherwise felt fine. He wasn't short of breath, but knowing what he knew about COVID, could this be an indicator? He had tested negative 2 days prior, but just to be on the safe side, he called the tournament officials and requested to be tested again. To his surprise, he was positive. Welcome to the IQT podcast. On today's episode, we'll discuss the promise of clinical forecasting and why COVID demonstrates the potential for improved capabilities in disease surveillance. We will also explore the opportunities to broker a transition from a sick care system to a healthcare system. Joining me on the conversation today are Dr. Dan Hanfling and Eugene Chiu. Dr. Dan Hanfling is a Vice President of Technology at bNext, the life science arm of IQT, singularly focused on the threats infectious disease epidemics pose to national security. Dan is an emergency physician, an expert in operational emergency medicine and disaster response, and a recognized national leader in healthcare emergency preparedness. He has been at IQT since the beginning of 2019, having come from spending 4 years as a senior advisor supporting the Department of Health and Human Services National Healthcare Preparedness Program. He currently co-chairs the National Academy of Sciences Forum on Medical and Public Health Preparedness. Eugene Chiu is a senior partner on IQT's investment team, leading IQT's investments in healthcare and life sciences ventures with IQT's bNext team. He has also been responsible for a number of IQT investments in the areas of quantum computing, advanced analytics, and artificial intelligence. Eugene has been on the IQT investment team since 2013, and prior to IQT, co-founded and led business development, marketing, and commercial operations at multiple venture-backed life sciences and enterprise software companies. Dan, Eugene, welcome to the show. Great to have you today. First and foremost, this topic, this idea of healthcare systems and forecast monitoring and national security. Why is this even important today and now? What is the context that brings us to this conversation at this point in time?
Well, let me kick it off. I think COVID has made clear the promise that new technologies and some not so new technologies can play in helping us identify where there's illness in the community and how to better protect people from potential exposure, and also how to protect our health system from potential collapse. So, COVID basically has accelerated what was chugging along prior to the outbreak at the end of 2019, and gives us an opportunity to look at digital health tools as a part of our health security capabilities.
I would add that COVID has really changed the awareness of digital health as well. So, telemedicine has actually been around, and telehealth in general has been around for a long time. But consumers now and the population in general public has really got an appreciation of the power of remote consultation and the power of digital health tools. And one of the biggest challenges is adoption of these tools, both by the patient or the consumer, as well as by the clinical community. And COVID has really accelerated all of that. So if you look at April of last year, 2020, a little over 40% of patient visits were done remotely, and that's huge. That's dramatically different than the adoption rates before, and it's also changed a lot of the way that even the broader reimbursement and regulatory environment recognizes telemedicine to provide for reimbursement of these types of tools. So we're now in an environment where it's being used and it has the opportunity to really make an impact. I mean, that's separate and aside from the financial environment, but just that adoption is a
Yeah.
big
So
deal.
certainly COVID has accelerated the interest of Dan, what you call RPM, remote, or what's referred to as RPM, remote patient monitoring. And Eugene, from your exposure on sort of the financial investment side, there's some big bucks involved here. You've spent some time, I think, looking into the market landscape, and you've looked at valuations and various activity in the space. Could you speak a little bit just about in general, early big terms here? How's big business sort of supporting this drive and this demand that we're seeing now?
So in terms of big business, I
Or
mean,
just big
probably,
dollars. I'm talking about big dollars here. It seems like a pretty big industry.
sure. So there's big business and there's big dollars in this. There's a little bit of both here. So in terms of the dollars, there's more and more funding now than ever before in what we call, and the broad space of digital health. So the first, Rock Health is a group that does a lot of investments in the space, but also tracks the space in terms of, and has been tracking it for the last 10 plus years in terms of funding and financings. And if you look at just the first half of this year, 2021, there were nearly $15 billion in digital
Wow.
health funding, which was more than all of 2020 combined. And that has been a significant growth over the past decade. So if you look at all of venture investment in, let's say, 10 years ago, 2011, digital health was just 2%. In 2020, it was close to 10%, about 9%. So as a share of venture investments, it's quite significant. The number of deals are increasing. The size of the deals are increasing. You've got IPOs and now SPACs as well in terms of public exit activity. So already there have been 11 IPOs and SPACs and another 10 or 11 expected later this year. So there's just a lot of activity as well as even consolidation of major players. Folks like Grand Run Health have merged with Doctor on Demand. You've got some of the bigger combinations that folks are aware of as well. But there are a number of different types of financing activities and types of deals going on in this space that just spurs, I think, more and more excitement and
So
innovation.
there's certainly consumer interest. There's a lot of business and activity in that regard backing this up. Let's take a step back from all that and think about how does this all really relate? We're on the IQT podcast. We certainly care a lot about national security. Any commentary on health security and its connection or relevance to national security in general?
Yeah. So when I think about national security, we're taking steps to protect the nation. Well, protecting the health of the nation has got to be a fundamental part of any consideration of assuring national security. And actually, that concept really came into focus over the last number of years, recognizing that health security is a fundamental aspect of national security. And the digital health tools that Eugene just outlined, which when I think of it in the context of telemedicine and real-time connectivity, much like we're connected now, sensors and wearables and other means to acquire basic information like the remote patient monitoring that you alluded to. And then the ability to take all that information and see it and use it for actionable decisions becomes the security component of the clinical, medical, and public health portion of this discussion. So health security really, I think, can be augmented significantly by taking what we have seen from the COVID-19 response and the tremendous interest in the use of digital health technologies, and, as Eugene alluded to, the change in the regulatory framework and the regulatory environment in which these tools are being applied. And it can really, I think, accelerate and promote, the concepts of health security as we've envisioned them, as we've described them, and as we clearly need them going forward.
And what is it that so when we think about remote patient monitoring, and we compare it to, say, in-person visits that we're all used to, I'll use myself as an example. No matter what I'm going in for, I'm always getting checked for my weight, my blood pressure, perhaps my pulse, in more recent times, my the oxygen levels that are contained within. How relatable or how common are some of these things becoming in a remote environment? In other words, the vital signs that we care for in an in-person clinical setting versus, say, one that is a remote setting. Where are we in terms of what we care for? Are they the same? Are there more? Are there fewer? And where do capabilities lie therein?
Yeah. So, there's a reason we call vital signs vital, because they really are the marker of how well or unwell any individual is. As an emergency physician, that's actually probably the first thing I look at when I first assess a patient in the ER. And it's actually probably the last thing I look at before I feel comfortable either letting them go home, or if they need to be admitted to the hospital, make sure that I've made a proper disposition in terms of where they're going, to the ICU or to the floor, wherever. So vital signs are critically important. And in this current state, with the degree of wearables and sensors that are now available, in fact, I think it was estimated just prior to the onset of COVID that probably 1 in 5 Americans wear a fitness tracker, the Apple Watch, Fitbit, whatever. Those tools really capture the critically important information: pulse rate, respiratory rate, sometimes temperature, movement activity, all the sorts of key elements that really make vital signs vital. And I'll tell you a quick story from my own history, going back 20 years to the inhalation anthrax cases in the immediate setting of the 9/11 attacks and what were essentially unprecedented delivery of anthrax in the U.S. mail system. And we actually were lucky enough, probably lucky more than good, to diagnose 2 of the inhalation anthrax cases that occurred in postal workers in the Washington, D.C. area. We contributed to the successful diagnosis of a 3rd postal worker. And we basically were alerted to the fact that there was something wrong because their vital signs were abnormal. Now, fast forward, to the present time. Think about the power of being able to look at a large population base and be able right off the bat to say, we ought to concentrate on this group of folks because their vital signs are abnormal. Their respiratory rate is elevated and their heart rate is elevated, which can be, again, indicators of illness. We may not know whether it's COVID or influenza or even, God forbid, anthrax, but we know that there's something wrong. And so that really is the power of being able to decentralize and move that data acquisition out into the community in real time, as opposed to having people come and essentially over what could be overwhelm the health system, seeking advice, seeking reassurance, seeking information with regards to whether or not they've been exposed to something.
And I think to Dan's point about so many folks out there now wearing these types of trackers, et cetera. What's powerful about that is that we have a lot of data coming in. And those various companies, whether it's Whoop or Fitbit or Apple Watch and others, or Ring, have partnered with various clinical facilities to do studies because they have ability to engage with the users, not only via the tracker itself or the wearable itself, but also via the app. They can ask questions. Do you have symptoms? Did you actually get diagnosed with COVID, et cetera? And they can use that information not to get, true clinically, sophisticated or well-designed clinical trial data, but just sort of high-level correlations to suggest whether the metrics that they are tracking are suggestive of risk of disease. There are now also companies who are doing well-designed trials to try to get FDA or regulatory approved devices for diagnosis or increased risk of COVID and other respiratory infections. Companies like Empatica. Dan, if you want to talk about them at all, but these types of things are also coming to the
Yeah.
fore.
So actually, I'd like to talk about both. First, just to highlight, the notion that that this sort of data now is being analyzed. Actually, there was an article that was released in JAMA last week that highlighted work that's being done at the Scripps Research Translational Institute in La Jolla that has looked at 37,000 individuals who have used a variety of different wearables, commercial off-the-shelf wearables, Apple, Fitbit, Garmin, etc., and looked at them over time to see if they could use that data both to highlight whether or not there was exposure to COVID, but in particular, they're now using it to look at that subgroup of patients who were exposed to COVID, confirmed exposed to COVID, and looking at long-term symptoms and whether there was an alteration of their vital signs that might be an indicator of the long haul COVID symptoms. So that I think is testament to the fact that there's a lot of interest and the data is critically important. Let me talk about Empatica, Whoop, Aura, and so on. As examples of startups that are honing in on the identification using their particular algorithms of specific indicators that might highlight risk of COVID. So, for example, with Empatica is looking at respiratory rate and has been doing work financed and funded by BARDA, the Biological Advanced Research Development Authority, to actually look at whether or not their platform might be an early detector of COVID. And indeed, they have some data recently shared that suggests that indeed you can pick up, based on subtle variations in respiratory rate, the risk of COVID. Same with Whoop and the example of the golfer that you provided at the outset of the discussion. So I think that what becomes very interesting is not looking at it from a retrospective perspective, but can we look at this prospectively and begin to amass this data in real time and link it geographically so that we can get a better understanding, predictive analytics, if you will, of where disease may be evolving. And that will be very helpful both with regards to giving information to individuals. It will also be very helpful to support the healthcare and public health systems in helping them augment necessary resources if it looks like that there's going to be disease in their given community. So the promise here is just tremendous, and I think that that's why we're talking about it today, because at the end of the day, I think that this really represents 21st century medical and public health, disaster and catastrophic health emergency preparedness.
Dan, that's really interesting because I think it's important to highlight again what you just said earlier, this distinction between information for the individual and actions that the individual might take, as well as information that could be looked at either for the system or for the community in general. So if you take a look at a company that you and I are both quite familiar with, K Health, this is an incredible application platform that combines artificial intelligence with an app that helps to triage, in some respects, individuals to understand what potential clinical condition they might have based on information that they provide and what other patients have had similar to them, if you will, and that's a tool that has immense power in terms of being able to deliver that information sort of anywhere, anytime, without having to wait in line, right? So immensely powerful information to the individual. They are scaling that nationally and in some cases internationally, where they are working with some large insurers and care groups to be able to provide their app. And all of a sudden, that type of information could be aggregated for the public health community type information and analytics that you just mentioned.
I'm really excited by this prospect of disease surveillance and being combined with not just surveillance and response, but perhaps, as Dan, as you've suggested in some regard, uh, creating a predictive capability. In other words, being able to see where disease evolution is taking place, where perhaps the next pandemic or epidemic may erupt. But I think a lot of this is predicated, from what I'm gathering from the conversation here, a lot of this is predicated upon the access to a good quality data set, good information, amassing large amounts of truthful data that can then sort of be used to infer and predict upon and potentially, understand something as just before it happens or long before it happens. So that's one thing that I just throw out there for us to think about. Juxtapose that with the concept, we're talking a lot about, I think you've all mentioned a number of companies, a number of large and small companies that are involved in sort of the wearable space, in the diagnostic space. If I'm applying what I understand about the way business works with the way perhaps what is with the way how things ought to go, if we're thinking about a large population's health, what happens when we start seeing things like companies hoarding their data? So, an ecosystem of openly available data certainly makes sense to help inform a predictive capability. But if we've got individual companies who are profit driven, motivated by doing business, how does that lend itself, or can it lend itself still to creating this capability we're talking about, amassing a large quality data set or a set of information that is actionable and very beneficial to the public, to the general public and their health concern? Open question to either of you.
Yeah, I mean, it's a good question, and it's a big question, and it touches on a whole host of issues, including privacy and security, and how the information is going to be used and to whose benefit, et cetera. I'll go back actually to highlight what Eugene highlighted on my comments, which is the population health, benefits here. I think that, and I'll tie that back to the notion of health security. I think that much like other data sets of value and importance, think about clean air and clean water and so on, things that actually have an impact on the population writ large, that this sort of data will need to be considered in that context. And as a component of health security or national security, if need be, there probably ought to be certain policies, procedures, guidelines, or other means of assuring that de-identified large-scale data sets are made available both for research but also in real time for the proactive visibility that we've just alluded to with regards to some of the public health data surveillance capabilities that this information provides. And I hate to say it, but looking back over the last 18 months, the one thing we didn't have data. We were flying blind. We were largely flying blind in the midst of this evolving pandemic, here in the United States, let alone across the rest of the globe. And that just shouldn't be in 2021. We should be able to see in real time, or as very near real time as possible, what is evolving in any given community. And I think that's where we are quickly headed. And I think that's where the promise of these digital health technologies, especially the wearables and sensors, combined with the telemedicine, teleconnectivity that allows not just the individual, but communities to be connected, I think is really where this is going. So hopefully that answers your question. It's a good one.
I think you'll also see that certain groups are actually relatively open with sharing, I wouldn't say the raw data, but the insights, some of the insights from their data. So another company that Dan and I are both familiar with, a company called Kinsa, has a website called healthweather.us, and you can go to that site and you can click on a map of the U.S. and click on a state and see information about risk details and county information. And where are they getting that? They're getting that information from real-time collection of app inputs and data that they're collecting from a network of smart thermometers that they have millions of smart thermometers across households in the United States. and they're showing that fairly openly, and you'll see that for other companies as well, is that they're showing the sort of high level data openly, but then they are also finding an opportunity to commercialize that information by providing more in-depth analysis and in-depth analytic capabilities to certain customer groups, whether those are municipalities or state governments or other public health agencies, or even large corporations who are interested in understanding what's the health risks within their large campuses and things like that. So I think what you'll see is different layers of sharing and openness, but also opportunities to commercialize that
And it's
information.
promising to hear. It's good to hear companies find a balance, strike a balance between being able to survive, exist, profit, and also provide sort of a social good there. So let's talk about we've spent a fair bit of time sort of establishing context, and I'm now convinced that this is in fact a very important conversation to have now, and there's a lot of evidence to support that, both in terms of population health needs as well as demand on startup businesses and big businesses. Let's talk about the current capabilities. Are we there yet? Do we have everything we need in order to enable full scaled remote patient monitoring? Are there limitations that we're facing currently? What are your thoughts on the state of affairs currently, and perhaps where we're headed, and where we might be deficient in order to make this actually work?
I mean, I'll start, and I'd be interested in Eugene's perspective on this as well. But I think from a technical and technological perspective, we're largely there. Again, if we're focused on vital signs being vital, then I think a number of the capabilities that we've alluded to over the span of the last 20 minutes in discussion, really get us to being able to capture that information with some degree of fidelity. I think that that is what is the holy grail, which is to further improve upon the clarity of the signal, the reliability of the signal. I think the big step that we still need to take is how to integrate all those inputs and be able to access them, interpret them, and then report them in a manner that, again, provides for actionable intelligence. That infrastructure does not really exist. That is still very much, in the words of our old colleague, Dylan George, very much bespoke to the individual companies and capabilities that they've put forward. And so what I think we're going to need to do is we're going to need to see more government involvement, frankly, in helping to create that kind of public health data infrastructure that will really be required to be able to ingest, analyze, predict, and report the vast amount of information that we would need to be able to make the kind of determinations going forward.
Yeah, I would agree with Dan. The technology has really changed over the last 5-10 years in terms of its availability, its cost, and its prevalence, if you will, out in the wild. So these sensors are inexpensive. They can communicate quite well with now almost everybody has mobile phone and ability to then connect to a larger network. So all these things are all out there. The adoption is beginning, and so it's really the interpretation of all of that information. And I think we're seeing that a lot here in the U.S. More and more, but there are certain other countries also who are very aggressive in this field. So if you look at China as an example, digital health has really picked up there. Some of their largest companies are digital health companies that are spin-offs or associates of the large, very large tech companies, and whether they're telehealth providers or they call them internet hospitals, or different types of of digital medicine apps, etc. That is becoming uh, more and more how care is going to be delivered in China, especially given uh, the number of physicians and clinical providers they have relative to their very large population in many cases remote settings, as well as uh, as well as just generally the cost to be able to provide that care.
It's a good point. I wanted to actually also ask a little bit about how do we think this will, the sort of the onslaught of these sensors and the remote patient monitoring capabilities. How will this impact the way that healthcare is delivered? I mean, from sort of a healthcare system or a provider perspective, right? Dan, specifically, you've had a long-standing career in what we'll call sort of the system leading up till now. How do you think you and your colleagues will either adapt or adjust, or what kind of changes do you think will have to take place? Broad big picture strokes here.
Yeah, well, you threw out a term in passing a few minutes ago that I was hoping we'd get a chance to come back to, which is sort of differentiating between healthcare and sick care, and it's probably just a turn of a phrase. I certainly didn't come up with it. I've heard others describe it as well, but essentially, for the most part, the U.S. healthcare system right now is a sick care system. We show up when we're sick, or we think we're sick, or we have questions of the doctor, and so on. And that is, from an economic perspective, that's very inefficient. From a healthcare delivery perspective, that's very inefficient, and it's oftentimes too late. So I truly believe that the capabilities that we've outlined today, that we're talking about in the context of an epidemic outbreak or other catastrophic health emergency, could actually be applied in promoting and improving our healthcare system that is more finely tuned and focused on preventative healthcare. Now, in order to make that happen, the government's going to have to pay for it. We're going to have to change the incentives for the way that healthcare is paid for. And there are a whole host of issues related to all of that, that would take all the oxygen out of the room, to stick with a medical sort of analogy. So there's a lot to discuss. However, if we bring that conversation back to national security, which again is about focusing on how to protect the nation, our economy is a key component of protecting the nation, and we look no further than what happened with COVID-19 to see, where the economy stood especially in the early days of the onset of the pandemic. So I think that over time, my colleagues and those who work in the healthcare delivery system will recognize the power of these tools, and over time, I think we'll figure out how to adopt them. At the end of the day, you still need a good decision maker. You're still going to need a good clinician. You're still going to need someone with excellent skills to do the surgeries or other interventions that are going to be required. But I think that we can, in the short term, begin to steer towards a greater focus on healthcare and move us away from just sick care, and use these kinds of capabilities to help get there.
I think that one of the biggest differences, to Dan's point about this difference between healthcare and sick care, biggest differences in digital health is the availability of it, that it's right there, and that it can, people are engaged with digital tools on a regular basis, sometimes too much, especially when it relates to our kids. But on a minute to minute, or certainly on a daily basis, we are engaged with our digital tools. And by doing so, now there's an opportunity for those digital tools, if you have the sort of healthcare element of it, to engage back. And so what we're seeing is more and more funding and companies that are being successful in digital health, working against these chronic or preventive care type indications like diabetes, right? Or even like, wellness, mental health. Mental health, in fact, was one of the top funded clinical indications in digital health over the last several years. So there are even digital health care companies, in terms of digital health treatments that are being pursued, that would be, FDA cleared or FDA approved treatments via digital technologies that are being funded these days. And so, inclusive of things like substance abuse, another company as example is Pear Therapeutics, which has announced its plans to go public via SPAC. And that's just one of, a handful of different companies, Woebot, et cetera, Thrive Health, who are pursuing, this general space of digital health. But beyond that, in terms of applications for IQTEL's government partners, et cetera, there's also, because of this regular engagement, there's also the opportunity to improve performance using these types of tools. And so you can be not only carefully managing your health as it relates to disorders or potential disease or being preventive in certain cases, but also proactively looking at performance activity and performance monitoring or performance improvement, areas that Dan is very familiar with in terms of his work.
Yeah, I mean, and actually, in the New York Times yesterday, there was an interesting article about the use of Whoop as a incentivizer for exercise activity. How guys are basically checking up on each other and saying, hey, I didn't exercise as much as the rest of my teammates did this weekend. I better go out for a quick run tonight before I call it quits, so that everybody sees I'm engaged. So there are. I thought that was an interesting added sort of capability. That again, Eugene, to your point, the fact that we live on our little digital platforms. And this is now just another element. It's going to be another extension of who we are and what we do and how we do it. And if we can take that information and turn it towards some of the things that we've discussed on this in this discussion, to use it for good, it'll be all the better. It'll serve the individual, and it can serve a population, writ large.
I could personally attest to the power of peer pressure for good and a little bit of humble bragging. I'm actually on a text chain with a handful of our IQTEL colleagues, actually, where we check in on a daily basis with digital receipts, a picture from the Strava app, maybe a picture of your health app indicating how many steps you've taken, daily basis, sort of keeping tabs on each other. And actually, if you don't send the digital receipt for that day, whether it's a track run or a walk or a hike or a swim, we actually have to, there's a financial penalty involved amongst all of us. We have to go through the pain of individually Venmoing every single person $1. We call it the pay to rest thread. I'll bookend our conversation by saying I'm excited that the future is now. Healthcare is already rapidly moving ahead in leaps and bounds with regards to adoption of digital health tools. I'm excited to see, based on our conversation today, where this will all end up and how it'll impact just, population health in general. Dan, Eugene, I want to thank you both for your time today. This has been a very exciting and informative conversation. I want to encourage our listeners to learn more about what Dan and Eugene have to say. You can learn more at bnext.org. That's bnext.org. And you can see digital health resources from the team, as well as featured op-eds. You can learn more about this particular topic at their blog at iqt.org/blog. Just look for Dan and Eugene's work. Again, Dan, Eugene, thank you so much for your time. I'm your host, Vishal Sandasera. That's it for today. We hope to hear and see you all soon.